Welcome, everyone. It's so nice to have you here with us, and it is so great to have Dr. Angel Ogbeide here with us as well. She is one of our very own Creighton Dental School graduates, and we are so glad to have her here with us. She most recently has been an assistant professor in the Department of Oral and Maxillofacial Surgery at Creighton University School of Dentistry in Omaha. She has had substantial experience working with marginalized patient populations in various community health settings, and she has several different research interests that include provider wellness. And I love that she is giving us a talk today on the art of wellness writing. I have actually done all the things she's going to walk you through today. I have been through this process, and right before we got started, Angel and I were talking about that I just submitted some of my work that I had written with Angel. And that's really, you don't have to have an end goal of submitting, but it's something that she is going to talk to you about. And just the act of writing some of the things out that you're going to participate in today is going to make a very big difference in your life. And that's what I noticed it as well. But after I got done writing, I was very excited about it and wanted to submit. Now, I don't know yet if I got chosen, if my work got chosen for the journal that I submitted to, but we will find out here in the next few weeks. So I am going to turn the time over to Dr. Angel Obeide for the art of wellness writing. Thank you, Angel.
Thank you so much. Thank you for the opportunity. It's a pleasure to get to speak with you all. And I'm going to talk about wellness writing. The title of my lecture is The Art of Wellness Writing and the Intersection with Scholarship. Typically, when I give a variation of this lecture, it's as a facilitator in a narrative writing workshop. And I always make this announcement. And so I still wanted to keep it in for today. If any of you are interested in utilizing this writing workshop or exercise with learners or with faculty or with staff, this is sort of a general rule I always have whenever we're in spaces where we can share our writings. It's a space of mutual respect. I always tell all the participants to be present. The purpose of the reflective writing is to discover about yourself and your experiences, to have humility and an open mind, not only to your experiences, but the experiences of others, and to observe some confidentiality. So as I put on the bottom, yes, this is not a therapy session, but I do encourage people to speak freely about their experiences with the understanding that it's not going to be shared outside of the writing workshop or exercise. Now, the objectives of this lecture are to demonstrate how narratives in medicine can be used to champion provider wellness, career development, and scholarship, discuss the research behind the use of narrative writing for improvement in provider wellness, discuss the history of 55-word stories, and learn how to write your own narrative, and then learn how to submit your narratives to scientific journals. So, to kick it off, I wanted to mention this novel. It was written by Leslie Marmon Silko. She wrote a book called Ceremony. And one of the unique things about it is there's actually no chapters to this book. It's structured in prose and in poetry. And that becomes important because a lot of narrative writing is written the same way. The protagonist in the story is a veteran who returns from World War II, who has, at the time, is diagnosed as battle fatigue, but what we would call today as PTSD. He is also Native American from the Pueblo tribe. And initially he gets treatment in the hospital, but his doctors end up determining he'll benefit more from recovering at home. So he returns to the reservation. And through different experiences and trials and stories and healers that he meets, he kind of finds healing within himself through stories of himself, stories of his family, and of his ancestral tribe. I think it's a great book. It's an atypical read because of the structure. So if you're interested, certainly check it out. But this is a quote from the book that I think is fitting for what I'm going to be talking about today. And it says, I will tell you something about stories. They aren't entertainment. Don't be fooled. They are all we have, you see, all we have to fight off illness and death. You don't have anything if you don't have the stories. Another aspect I want to bring up whenever you talk about narrative medicine is Dr. Rita Sharon. She's an internal medicine physician by training, but she is sort of the founder, so to speak, of narrative medicine. She started sort of exploring it while at Columbia. She still works there to this day, and she's written a couple of books on it. One is called Narrative Medicine. The other is called The Principles and Practice of Narrative Medicine. And she's been instrumental as far as building a graduate program around narrative medicine, incorporating it into their undergraduate medical education and their graduate medical education. And she wrote an article for JAMA a few years back, but I think it illustrates sort of her motivation in cultivating just the practice of narrative medicine that I think is really appropriate to share. She said, sick people need physicians who can understand their diseases, treat their medical problems, and accompany them through their illnesses. And that's sort of a theme to keep in mind through the topics I'm going to discuss today. Is healthcare is a process. Everyone's healthcare journey can be a process, in particular in situations that are of higher risk and higher concern. That's something to be mindful of. It's sort of the holistic approach and understanding you are treating a whole person and you are part of their process as a clinician. So there is another quote that I want to highlight that actually comes from one of her books that she wrote on narrative medicine. And she made a point to emphasize that a scientifically competent medicine cannot help a patient grapple with the loss of health and find meaning in illness and dying. And I found that interesting myself in having patients with terminal conditions that oftentimes we rely heavily on science, but there is an aspect of the will to live, the desire to live that isn't as easily understood just with science. And there is another component that always has to be considered. And I think that's important to understand in this realm. Where did all this come from? So there was a study done in 2008 with Chad Burton and Laura King in Columbia, Missouri, with undergraduate college students. And it's titled The 2-Minute Miracle. And essentially what they wanted to look at is what is the minimum amount of intervention as far as expressions, emotional expressions in writing necessary to have health benefits. And so what they did is they had two groups of students. One group of students, they gave them writing topics of either writing something, a traumatic experience or a positive experience. The other group of students wrote about a topic, just a standard writing topic, whether it was a sporting event or something like that. And what they did is they had them write for 2 minutes a day for 2 days. And then they followed up with them about 4 to 6 weeks later. And what they noticed was the students who wrote about traumatic experiences or positive experiences had less systemic health complaints than the students that wrote about a standardized writing topic, which I found really interesting in the fact that they only wrote for 2 minutes for 2 days and they were able to garner that. So I think that's something to note. Another thing I wanted to mention is this was an article that was published in 2022 in Primer, which is a family medicine journal. And these authors sort of looked at, where does writing fit in clinical healthcare, in particular in light of what we learned from the pandemic. And they highlight different aspects of writing, whether it's narrative writing or more scholarly writing. But their goal of it was because the National Academy of Medicine made a national plan for health workforce well-being, they made a point to bring up the importance in providing support for mental health to reduce the stigma that's often associated with it for healthcare providers. And what they found is that writing narratives can be helpful in reflecting on experiences that you have as a provider. It can be beneficial in providing support for your colleagues. And it can be a great way out of the non-traditional realm to get scholarly work accomplished. Oftentimes, a lot of clinicians, either because of RVU demands and just sheer time, don't necessarily follow the benchtop research approach. And oftentimes you don't have much experience with that, but are still expected to do scholarly work, in particular in situations of promotion and tenure. And what they found is writing narratives provides another way to do that, as well as a opportunity to reflect on healthcare experiences. There's another study that was done, and yes, that's not a coincidence with the last name. That's actually my older sister, who is faculty at UT Health Science in San Antonio. And they actually did a study with their family medicine residents on reflective rounds as far as using narrative medicine, but incorporating it into their grand rounds program. I do want to give a caveat that these residents were residents during the peak COVID era. So these were residents that, weren't allowed to go to social events with their co-residents. All of their grand rounds were virtual, um, limited to show social interaction with families. A lot of them got pulled for a good portion of the residency to cover COVID units, where a lot of people were just dying. And so that's sort of the population of residents in the time frame that their resident experiences were going on. What they found, as far as the feedback they got from their residents, is that one, their residents would have appreciated snacks, so that's something to note, but also that they enjoyed it so much that they think it should be built in to the Grand Rounds curriculum versus making it like an optional exercise that has to be done on their downtime. They wanted it to be built into the curriculum, and they wanted discipline specific. So these were family medicine residents, so they wanted to talk about topics that typically family medicine residents would face. They also brought up they liked that it was specific to their year in training. So the first years with the first year, second years with the second years, third years with the third years. And I think some of that is just experience, but it's something that I think is important. They did it as a pilot, and I think the positive feedback says a lot, in particular for these residents who came through training at a very unique time in history that was, as we learned, a big magnifying glass on some of the deficiencies our current healthcare system has as far as provider burnout and wellness. And it's something that provided their residents an opportunity to self-reflect around their cohort and their colleagues. This was another article written recently that talked about different factors that can impact scholarship delay in URI and faculty. One of the ones I really want to highlight is situations where there's a lack of support for research mentorship. I know, like I mentioned in a few slides ago, for just clinical faculty in general, the research side of things can be difficult. I think depending on, your professional school background, you may have some research experience or little to none as far as what that institution offered. But I think entering a space where your clinical demands are heavy with little research mentorship, one of the things I appreciate about narrative writing is it provides a way for you to still get scholarly work published in high index journals while without adding an added burnout. I think it's twofold value, in my opinion, in that it's a reflective writing exercise, and there's health benefits to that I mentioned in the 2-minute miracle study, but also there's publications, and in someone who's on a promotion and tenure track, you have to publish, and so I think it provides another avenue that's less traditional for you to get some publications, at least get your foot in the door, in particular for clinical faculty who have never published, as a way to become a first-time author, I think is important and something that I appreciate about that. And I think it provides a platform for support and more opportunities. I know with some of the 55-word stories I've published, I've had opportunities to read them at conferences and collaborate with other healthcare providers from different disciplines across the country that I otherwise, being in the dental field, may not have access to. And it sort of provides a mutual, what I would call a sacred ground, and to talk about a lot of experiences that we often have as healthcare providers, where we have a tendency to either brush off the traumatic experience or positive experience. Or even sometimes I've heard people who will kind of make sarcastic jokes to sort of downplay the impact that it has on. Even though, as we've known, if you look at the literature, traumatic experiences and positive experiences do have impacts on us, on our physical health, on our mental health. But I think it's finding spaces where you can share that information safely is really important, in particular in a time where we're just seeing higher rates of burnout and depression and anxiety amongst healthcare providers. I work in the dental field, and I know for a long time, and I think still currently, we have one of the highest suicide rates, which is concerning on many fronts. But I think a lot of that tends to boil down to isolation. In particular, in the dental field, a lot of people go into practice by themselves, and there's sort of this isolation that comes with that, that oftentimes can be a contributor to the unfortunate outcomes. But I think that's something to know. And what I appreciate about narrative medicine is it provides another pathway for that. So, what is the hope of 55 word stories? First is wellness and well being. I'm going to talk about the scholarship aspect of it, certainly, but at the forefront and the most important aspect is this is a wellness exercise for mental health. The scholarship is just an added bonus. And like I noted here, it provides a pathway for scholarship for it. So, what do you need to be able to do narrative medicine? It's having clinical skills, right? And like I mentioned before, it can be traumatic stories of traumatic experiences, but it can also be positive ones. It can be ones of illness or pain, but it's just significant stories. Whether it's the vantage point that you're writing as the provider yourself, I've had people write them as a patient perspective. I've had them write it as a loved one of a patient. And not even all healthcare providers. I was at a conference and an oncologist actually had a support group write their own 55-word story and then submitted it on their behalf, and that was published. So I think there are different avenues to understand that. But to be able to do that, you have to recognize those experiences for what they are, whether it's painful, traumatic, or just significant, and be able to absorb it. A lot of the practice of this is sitting with that experience, whether it's for a few minutes, whether it's for a few hours. I know when I teach this as a facilitator for workshops, I'll provide time to the participants to sit with some music on and just sort of marinate on that experience and how they view it for themselves. The other aspect is then to interpret that. What does that experience mean to you? How did that impact you? What were your takeaways from that experience? And then how do you respond? How are you going to write about it? What's the vantage point that you're writing about the experience? What was the outcome of that experience? And then to just be present with it. I think oftentimes what I've appreciated about 55 word stories, some I've submitted for scholarly publication, some I haven't submitted yet, some I may never submit. But it gives me an opportunity to sit with that experience and process it in the moment in situations where I would otherwise ignore it or brush it off. And as we know, sometimes the impact of those traumatic experiences will come out in a different way when we don't find ways to address them. So the thing to understand is to familiarize yourself with the practice of narrative medicine and the benefits that it has. So for the patient, it can teach them to listen, to listen more discerningly, and it can teach you from a provider perspective to also listen more discerningly. It can teach how to understand different viewpoints, to improve communication skills, and to foster tolerance and acceptance. I can think for myself of times where I've written with a colleague about the same situation that we were both present for. And the way I wrote about it, the way they wrote about it is vastly different, which can factor into different people's experiences and their backgrounds and how that shapes your viewpoint and how you interpret things. The other aspect to consider on our end is it does give us an opportunity to confront bias, assumptions, and preconceptions that we may hold, whether it's for patients, for diagnoses, for situations, and it can determine how we interpret those things. It can heighten our personal awareness and to foster self-scrutiny in a positive way. I think there's some internal reflection as a provider that is always good to continually do. And I think this provides an opportunity to do that. And lastly, just for the community at large, it provides an opportunity to provoke wide-ranging moral inquiry. That's why I'm a proponent of publishing stories, is that it does give the general public an opportunity to read what it's like through the provider lens, if that's the lens that you're writing, through the patient lens, or through a loved one lens. It can reveal tensions and conflicts of moral life. It can foster critical and empathetic thinking, and it can complement a principle-based approach. I'm going to spend my time today talking specifically about 55-word stories. There are other types of narrative medicine, whether it's short stories and things that happy to discuss at another date, but today specifically I'm going to talk about 55-word stories. And Dr. Fogarty mentioned that 55-word stories are small jewels for personal reflection and growth. I do want to give a caveat. Whenever I've taught workshops on this, people, sometimes either think 55-word stories, oh, that's really easy, or they think that's really hard. And I think it's somewhere in the middle. But it's a unique experience because it's a very short story. But I think the thing I enjoy about it the most is a lot can be conveyed in very few words. So the kind of definitive, definition is a 55-word story is a brief piece of creative writing that uses elements of poetry, prose, or both to encapsulate experiences with healthcare. So there's different parts of a 55-word story, and while we won't today specifically write one and share with each other, this is something you need to keep in mind when you're reflecting on the experience you want to write about. And the story that you write should have all four of these aspects. It'll have the setting, so where are we? The character, who's involved, the conflict, and I say conflict, it may be actual conflict or it can just be what is actually happening. What's the inciting event? What's the significant event that this story is tied around? And then the resolution, what was the outcome of that? And in some situations, and I'm going to read one of the stories I wrote, you don't know the outcome. But I think that can be helpful because oftentimes in healthcare, depending on your specialty, you may never see the outcome of what happens to that patient. So I think that's something to note. These are sort of the four portions of it that should be involved in every story that you write. So this is one of the first 55-word stories I ever wrote, and I did get it published in Family Systems and Health. It's very significant to me because it is a personal story. I will give you all a little bit of context. So as previously mentioned, I am a Creighton dental grad, and I'm also a twin. I have a twin brother who is a Creighton medical grad who graduated from the School of Medicine in 2017. And this is an experience that happened while I was in dental school when he was in medical school. He was in his third year, they're doing their preceptor rotations, and I had called him one evening just to check in, even though we lived together, our schedules were just different. And this is the encapsulation of that conversation that we had. And the title of this 55-word story is Step Back. It was our nightly call. I could tell something was wrong by his tone. I didn't get to do anything. My twin brother, medical student, stated. Patients said they did not want Black people touching them. What did the resident do? I asked. Nothing. He told me to step back, he said. There is a lot in this story, and like I mentioned previously, a lot can be said in 55 words. A lot of emotion can be evoked in 55 words. There's a setting, there's characters, there's a conflict, and there's a resolution. I have the honor to get to read this at the CFHA conference in October, and it was actually pretty cool. They ended up having a discussion afterwards about each story read. And what I value most about this is, sure, it's great, I got a publication, I'll never complain about that, but I think it provided me a platform to speak on experiences that I know are not necessarily unique, unfortunately, but also provide a platform for my brother to share his experiences. And it's one of the favorite things I've ever written, one that I'm very proud of. Um, and I always get emotional when I read it. I'm gonna read another story. So this story is about a patient experience that I had as a PGY1 intern for oral surgery in July, which, as we all know, is a very rough time for the hospital system because most interns don't know much. And I was on call. So, not to get into the weeds, but with oral and maxillofacial surgery, we take facial trauma calls. So, someone gets punched in the face, someone gets shot in the face. We also take that call. And so, I got paged at 2 o'clock in the morning. It was a busy level 1 hospital, and I'm going to do a consult on a female patient who has significant facial injuries. And I'm going to read it to you and then I'll elaborate a little bit further after that. The title of this 55-word story is We Know What This Is. I remember staring at her bruises. There were so many facial fractures, I lost count after a while. He was sitting right there, asking me to affirm her fall. She didn't just fall onto that fist. She kept avoiding my eyes. My stomach kept churning. Stop panicking. What am I supposed to do? So, um, I think we all have experiences as providers where if it happened again, you would handle it differently. I think walking into that room, and it became clear about sort of the nature of how my patient got those injuries and understanding what are the next steps, how can I help this patient, and how can I do that safely. And unfortunately, that experience wasn't isolated. One thing I have found in facial trauma that are non MVC related injuries, oftentimes it can end up being an IPV situation, in particular with female patients. That tends to be a high propensity or high logistically reason that they end up having a facial injury. And so this one stuck out to me because I never saw that patient after surgery. She did not come for her follow-up, so I do not know what it ended up happening. But it's something that I sit with and reflect on, and she always will come to my mind periodically because this was the first experience I had had with a patient who's in an IPV situation. And it's one that it's just very significant because it's very complex. And I think as a new resident, it was a lot to take in and process, but it's an experience I'm grateful for. And I'm glad I was able to sort of solidify it so that other people can read it and feel seen and heard. So I am going to sort of walk you through the process of writing. I know we're not going to necessarily do it in this setting. But after this, if you on your own time want to write a 55-word story, this is sort of the stepwise process of how to write it. The first thing, like I mentioned previously, is you want to think of a compelling story based on your experience. Now, whether that's your experience as a clinician or provider, whether it's your experience as a patient or just a bystander watching or as a loved one, is totally up to you, but something that's significant to you, whether it's positive or negative. And then write down everything you can. I always tell people at the beginning, be less concerned on your word count. You can always, cut it down to 55 words later. I think in the beginning, it's just writing down the ideas and things that come to mind about that experience. Once you kind of get everything written down, um, put it away for a little bit and then come back to it and see what else comes to mind. And then start to read over that, sort of clarify the storyline of what angle you want to write about that experience. And then that can sort of begin the editing process of this. And then once you sort of have started the editing process with how you want to do it, You can sort of share, what you've written with other people to get their feedback or not. It's up to you. Sometimes I don't. I think on the stories I'm going to keep for myself, I don't typically share that with anyone. But if it's one I'm going to submit for like scholarly publication, then I will have a few people read it just to give me their feedback on the subject matter, on the setting of how I've written it and the style, just to see if there's anything they recommend, and even just simple things like syntax, if there's things I need to change or move around, just to get some opinions on that. And then that's where you keep editing and keep editing. And this is where you have to work to get it down to 55 words. Sometimes it's easier to do it. Then I've had situations where I've had to get a little creative and change how I phrase things or cut things out to make sure I can get the word count down. If you feel like you can't do that, then you may want to evaluate a different style outside of 55 words. You can write short stories, you can write poetry. There's other narrative medicine pathways that may be more appropriate for that writing work if you feel like it's not going to work for you to be able to cut it down. And then what you do with it after that is sort of up to you. I always encourage people to publish some work, not necessarily everyone. And I said for myself, I don't publish everything I write, but the ones that I feel that I've reflected on and made peace with and feel comfortable sharing, those ones I do submit for publication. And I think there's just a lot of benefit in that. And the conference I was at in October, getting to hear other people's stories was really, really an honor and just a unique experience. I think positive experiences, but also painful ones, can be such sacred ground. And I think whenever anyone will allow you into that space, I think it's such a privilege and honor. And so I just encourage all of you at some point to think about submitting something for publication, maybe if not now, sometime in the future. So there's different journals you can look at. This is a QR code for a bunch of journals. There's one that's not on the list here, and that's Family Systems and Health, and also the HCA Journal of Medicine. I will give a caveat when you're submitting, just like you would have to for any scholarly manuscript. Usually you have to have like a cover letter, like a title page. You want to like make sure you number each line of the manuscript. So if they ask for any revise and resubmits, they can refer to the specific line, just like you would for any scholarly work. You have to have a title of it, just like you would for any scholarly work. But I think what I want to sort of highlight is there's a lot of high index journals that do have a humanities section. So I think that's really important. And like I said, I've submitted to HCA, to family medicine, to family systems and health. And I know there's a few other journals that will take publications. And don't be discouraged if you're not a physician to submit to those journals. Like I said, I am a dentist by training and I've submitted to all the journals are more, they're medicine journals that I've submitted to and haven't had issues with that. So whether you're a clinician or a researcher or you deal more with the didactic side or basic science or auxiliary, I think we're all in some aspect involved in healthcare and a part of the healthcare team and system. And I think everyone's viewpoint is important. And so to credit these journals, they agree too, because they platform different vantage points and even patient perspectives they also offer. So that's something to keep in mind. This is the end of my talk. So typically when I teach this, I'll actually give people time to write a 55-word story. I'll usually give them about 10 minutes to just jot something down and share with the group. This setting, I'm not doing that, but I really do want to encourage all of you to consider taking some time, whether that's today or another time, to sit down and write. Like I said, I think it's such a important aspect of healthcare is to reflect on all the experiences that we have, because I think it not only shapes us as people, it shapes the clinicians that we are and will be, and how we relate to our patients on a human level. And I think it just provides an opportunity to process situations. I think I too was a resident during the pandemic, which is honestly just a surreal time that I think in the moment you don't really process what those experiences were. But I think this sort of narrative writing exercise has provided me an opportunity to reflect on them, not on negative, positive experiences too, on what it meant to me. And I think even now, as a provider, as a teacher, that's something that I'm really grateful for because I think it's provided me a way to demonstrate what an experiences was for me, and it provides people insight into me. And so that's something that I implore all of you to consider. And I hope you'll write, and I'll provide my contact information. I would love to read whatever you write. If you want feedback on anything that you write, I would be honored to give you feedback on edits or suggestions and be of any help that I can be. And this is how you can contact me. And if you have any questions now, I would be more than happy to answer them for you all.
Thank you so much, Dr. Igbeidi. I do have a question while people are thinking of a question or
Yeah.
typing something in the chat that I want to start with. So, I teach medical humanities with our M1s, our M2s, also our PA students. And we always, especially because we are Creighton, we always have them do some reflecting, either on the articles that they've read or a video that they watched. Um, and as they reflect, sometimes it's more personal than other times. And I wonder what your thoughts are in this social context of care that we're teaching them. I wonder what your thoughts are on how much we should have them share. We do get in small groups and have them do some sharing about some of the writing they did. Um, but how do you work that with learners as we're talking about reflecting? Does it need to be shared at some point?
I think so. I gave a lecture to some doctoral clinical psychology students. I believe they're third years, and it was built into their course curriculum. And their actual final assignment was they're going to have to write a 55-word story and present it to the class, which can be a lot in some situations, but I actually think the earlier the better because I think you're developing the future healthcare workforce. And I think that the earlier the intervention can be introduced of just the reflecting exercise, I think it's a lot better. I think it's easier to teach it to an M1 and a PA first year PA student than to an M4 or to a third year resident. I think the earlier it can get introduced and they get in the habit of reflecting on patient experiences, I think will make their, preceptor rotations, their M3 year a little bit better. It may make how they interact with faculty a little bit better. The conversations that they're willing to have with patients, I think can be better. And I think that's something even for myself that I wish I would explored earlier because I think it teaches a better coping strategy, whether they write about experiences clinical side or just being a professional student in those experiences. I've seen a lot of classmates who went into professional school, no depression or anxiety, and left with a formal diagnosis of depression and anxiety afterwards in PA school, pharmacy, PT, OT, nursing, dental school, med school. And so I think that's something in and of itself is teaching coping strategies of how do I reflect on the experiences and what's going on around me. And I think there's value in sharing it with their colleagues because I think I hate to say it this way, it humanizes people a little bit more. I think sometimes in learning environments, people can see their classmates as, oh, it's just my classmate, whether they're their friend or not. But I think it can give you a more common ground to understand, oh, they have had traumatic experiences as well. Because sometimes I've been surprised of some of the experiences people have had because some people carry their trauma differently. And so it may not be as obvious. So I think in some capacities, sharing it with the group, I think there's value in that. And it takes courage. And I think that's a good skill to teach is how do you have difficult conversations in that setting with people because it's something in healthcare they're going to have to do at some point. So I think it also provides them an opportunity to practice that.
Thank you for that. Any other questions? Any questions in the chat or something you want to unmute and ask Dr. Obidi? Okay, we have something in the chat. I wonder, how have you guided others in dealing with the psychological weight that an exercise like this can carry? So, thinking about your own writing that you read to us today, and you said every time you read it, it has some emotional context for you. So Chris, is that what we're asking? Yeah.
Yeah, that's kind of what I'm asking. So when I think of starting an exercise like this, I often I let me preface some of this. So I've been in medicine for about 25 years. I'm a nurse practitioner. I was a critical care level 1 trauma nurse for a lot of years. I did burn care for about 7 years in the Arizona Burn Center. And we all lived through COVID. The trauma's there. And an exercise like this, a reflective exercise, I think is excellent. I'm also in process of my PMHMP, and I'm going to focus on psych actually for the rest of my career. I do find this helpful and fascinating in how reflection does in a cathartic manner kind of work to help ease some of the strain that happens, especially in medicine. But I wonder, especially now as I teach undergraduate nursing,
Mhm.
um, there are skill sets that we have as individuals, and sometimes forcing people to be exposed to this without guidance can be challenging. It can be just challenging for those individuals. And I just wonder if you had any thoughts on that and like how to best do it to keep them safe. I guess that's the best way to put it. So I actually teach psych for the nursing school, and sometimes I have to preface some of the conversations we have to ensure safety for these folks, so that they can go through the exercises that I even teach them in those undergraduate courses safely, and they don't come out more challenged than they went into it with.
I think kind of like what you started to say, I think prefacing the conversation in the audience. So I taught 2 workshops on this with health science faculty in the fall. I did one in person and one virtual. Nothing was recorded. That was the stipulation that I made, that nothing could be shared in any capacity outside of the workshop. And I also, in those settings, I actually did make it optional, because it was more of a hodgepodge group of people who we may not have all known each other. In the setting where I taught the workshop to the psych students, they're all classmates, so it was a bit of a more controlled group. But I think, or I'll say this, I think the hope in this situation, I do think the facilitator matters a lot. I think having a facilitator either that they're comfortable with or having someone else present with the facilitator that they're comfortable with is a good place to start. I can say for myself, if I was a student of some random person I've never met, I don't know if I would feel comfortable. And I think encouraging everyone to participate. So whenever I teach the workshops, I try and make it a point to write something myself that I will also share. So it's less of a let me show you what you need to do versus no, we're all going to have a discussion and participate equally and share. And to my surprise, it's as far as the workshops I've taught, that's been the most productive route. And people have always surprised me in spaces where I thought, students probably aren't going to say much. A lot of the times they're willing to be more open in those spaces because a lot of times they don't have any other realm where they can speak freely about some of those experiences. Um, and I think that's something, it was like a month or two ago with the psych students, and I was just surprised on some of, even at that early in their educational careers, some of the experiences that they had had. And even for me, that was a learning opportunity because I think sometimes we don't realize some of the impact certain experiences can even have when they're a first year nursing student or a first year dental student, that they're not really in the clinical heavy side yet, But I think for me, that's been the most productive way is a lot of it will boil down to who the facilitator is and the facilitator's willingness to hold space for other people. I think it's never, whenever someone reads a story publicly, I don't critique, because for me, that's not the goal in reading it out loud. It's to not tell you, well, the syntax here is a little off, or I would change, from first person to second person. It's more of like the boldness to share your experience and then applauding them for being courageous enough to do that. Hope that kind of answers your question.
It does. Thank you. And I
Yeah,
appreciate you bringing this forward too. This is an excellent lecture. I having starting to learn how to care for ourselves is so critical. Obviously that's become something that's been exposed over the last 5 years or so that we've talked
yeah,
about almost like in an aloof manner for
yeah,
decades.
right.
But yeah, so thank you.
Of course, of course. Any other questions I can answer?
Hey, this is Shelley.
I,
Thank you very much, Angel. I don't know that I have a question or perhaps a comment. I've been doing something very similar to what you're describing with nursing leaders and telling their stories. And kind of to Chris's question, I start the workshop with saying, telling your story is a very vulnerable thing. It makes us all very vulnerable when we tell stories, and that's okay. I don't think there's been a single workshop that I've done where amongst nursing leaders that there hasn't been tears from somebody. But I love this concept of the 55 word story. Who was that author again? I'm sorry, I missed that. Or maybe it's yours, I don't know. Who coined this idea of the 55 word story?
so her name's Dr. Rita Sharon.
Okay,
She's an internal medicine physician based out of Columbia University School of
okay.
Medicine.
And she's written articles, I'm assuming, on it.
She has written articles, she has written books, she has given talks, she has done quite a bit on it, but it's pretty incredible. She's kind of, for lack of a better word, where it originated as far as in a healthcare space was with her.
Okay, and it was Sherman. I'm sorry, I didn't
But
have a pen.
it's here. Let me go back.
There. Whoop,
Oh, did I go past it?
you have Colleen, somebody, I
Put it
thought.
in I put it in the chat as
Oh,
well.
Rita
Okay,
Sharon.
perfect.
Okay, thank you.
Thank you.
Yes, and Shelley has done some great work over this last semester. I've been part of her book study, her book
Yeah.
club. We've been doing a lot
Awesome.
of storytelling and your vulnerability, Shelley, is what facilitates so well. Because you've shared some stories. Um, and so I think you are able to do this. It's just when we're talking about a 55 word story is taking that larger story and just kind of whittling away at it
Mhm.
to make it something that is so impactful with few words.
And I think what Angel said too, though, right from the start when she was answering Chris's question is got to be vulnerable yourself. And
Mhm.
she said, share your own story. And yeah. And geez, sometimes I think, oh my gosh, I don't have a story with this topic. But so many times, if you just really think about it, you do.
Right.
Yeah. Yeah. So thank you very much. I really enjoyed today. It's right down my alley.
Awesome. That's wonderful.
Well, and the other thing that Angel brings up is you could have a story as a patient. You could have a story as an educator. You could have a story as a clinician um, with a patient. So there's a lot of different ways that you could come at your story. Any others? Anybody else want to unmute or type anything in the chat? Well, thank you again, Dr. Ogbeide. We are so grateful for your knowledge and for sharing of your time with us.
Thank you guys so much. And like I said, if there's anything I can ever do, please let me know. And it's really been a pleasure. Thank you. Thank you all so much.